cultural competency has been really important in this process, because at the end of the day, a lot of the students who maybe seeing a doctor for the first time, maybe from a different country and all these things, might not feel comfortable to talk about what's going on because they don't see someone who looks and feels like them who can understand their needs. So I think that's where we come in, and we're just making a difference in that respect, for making sure, they have people that look like them on the platform who can actually deliver the care they need.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Crystal Evuleocha, co-founder and CEO of Kiira Health. Kiira is the women's telemedicine company focusing on the women's health space, starting with colleges and universities. We talk about how Kiira initially focused on foreign students while they're studying in the US. One thing that Crystal and I have in common, actually. Crystal is a Nigerian immigrant who does not come from a healthcare or medical background. She came to the US to study economics and business administration from the University of Houston. Her personal experience drove her to start Kiira. Crystal's persistence and openness to feedback had helped her in this journey. It's really fun talking to her. Here's our conversation. Great. Well, thank you, Crystal, for joining me today. You're zooming in from LA, so at least we're in the same time zone.
Yes.
Thank you for joining me again. I thought it would be good for us to start. You have quite an interesting background. Tell us a bit more about how you get where you are today. Why start a company in this healthcare space, specifically Kiira Health?
Awesome. Well, thank you again, Christine, for having me. This is such an honor. I guess my story and my kind of journey is very non-traditional, and I'll say that in a bunch of different ways. So I guess I can start with where I come from. So I'm originally from Nigeria. I went to boarding school growing up for 6 years, didn't quite live at home. And then when I was 17, I actually moved to the US. I traveled here all by myself, which was a very interesting trip for me. So I come from a very conservative background, so to speak, and we didn't quite have any conversations about women's health or just health in general. It's usually like abstinence till you're married. Don't talk about those things, and I kind of took that with me coming, to the US and starting my new college experience and all that stuff.
Where did you go to college?
I went to college at the University of Houston. Houston was my place to go to for a number of reasons. There were so many international people in Houston, and it's super warm. So making that decision was very easy. So I went to school at the University of Houston, and I've always been an entrepreneur. I used to do hair and nails, and I used to sew clothes. So I actually made clothes while I was in college to kind of support myself in addition to whatever I got. As an international student back then, was very difficult to get the jobs. Like, you're competing with everyone, including the work study kids. So I started doing a lot of hair, like I said, and making a ton of money doing that. But I, decided to kind of, focus on school, do something that's less tedious, right? So I started making clothes, and then that led me to kind of starting my first company, which was an e-commerce company making men's accessories. So everything from ties, bow ties, lapel pins, and things like that with African fabric. So that was my first venture, so to speak. And in that time as well, like I said, being from a conservative background, I had a really traumatic health experience myself, where I was, Googling all my symptoms. I didn't really want to talk to anyone about what was going on with me. I was really shy and embarrassed about my, women's health concern, that I just relied on the internet for answers to my health questions. And started self-medicating for period cramps of all things. And a few days after, I passed out, was rushed to the hospital for emergency surgery on a condition that was very different from what I was Googling, of course. That was a scary, it was a scary experience, but then it led me to really thinking about ways to increase access to health resources, especially for young women who might not, one, either ever have like an OBGYN or a doctor or anything, or are just entering into independence for the first time and taking care of their health. So that's why I started my company, Kiira. Yeah.
Maybe you can tell us a little bit about what is Kiira Health.
Yeah, so Kiira Health is a digital health company on a mission to, like I said, increase access to health resources for young women and to also destigmatize the conversation around their health issues. The Kiira platform itself is composed of a mobile app and a platform where people, I would say women, young women, can access clinicians. So they can talk to OBGYNs, nurse practitioners, midwives, therapists, mental health experts, and more. And it's available via phone, video, and chat. And the dashboard on itself allows administrators, be it like a university administrator, what have you, to be able to kind of monitor how their students are doing. So,
And so, tell us about how you come up with that idea, and then it's like, and how do you execute it, and where you are now with the company?
Ooh, okay. It's been a very interesting journey, I'd say. So I came up with the idea, like I said, in college. Didn't quite jump into it. A lot of times it doesn't happen that way, where you just start a company just like that. I had the idea, I had the concept. I was kind of, thinking about it, doing a lot of research into women's health. Started to kind of, I'm not a medical doctor and I don't come from a healthcare background, and I'm also not a technical person. So it was a lot of new things that I had to figure out, which was more getting all the mentors on the clinical side and getting all the mentors on the technology side, and then learning, the business of healthcare and how to actually deliver, care in this way, in this digital realm. So before I actually launched, I did a lot of, I would say, outreach to a lot of people on LinkedIn. LinkedIn is my favorite place because I spend a lot of time on LinkedIn. So I sent a lot of emails to so many doctors and so many health administrators and, just asking them questions. And a few responded. A few really were like, okay, this young person, let's find out what she wants to talk about. so I would just book a meeting with them. A lot of times I didn't really know who they were in terms of their title. And I think that was an advantage for me, because I ended up finding myself having meetings with top CEOs and, head of hospital systems. And for some reason, they took a call with me. So, going from that, and then based on that, I started doing a lot of market research, just trying to find that product market fit and trying to see, is there a need for this thing? Because it's one thing to say, well, this happened to me and I want to just do it. But it's also are you providing something for folks in a way that, one, someone will pay for it, and two, that it would actually add some value to their life. So, did some research. I would say it took almost a year to just really nail everything down in terms, and it's always evolving and changing and all that stuff. But it took a long time to just kind of figure out, is this the viable business outside of the fact that, there's a huge social impact here, right? So figuring out that portion, like I said, it took a year. Then I finally started the company in December of 2019. And through that period, fundraising was very tough when we started. It was like, who is this person? What does she know? She's just coming here to talk about changing the world. So fundraising was tough. And then I started, trying to figure out what are the best ways for me to learn how to fundraise, learn how to speak, learn how to do these things. So I started to do a lot of pitch competitions. I was everywhere at some point. So we started raising money. First, we started to like 5,000 to 10,000 to free competitions where we didn't gain any money, but it was just really good exposure. Then we started to actually get real funding that way. And then in that same process, and I would say in the process of seeking mentors and asking people for help and things like that, I actually, in that process, got to meet who's now my chief medical officer and my co-founder. Her name is Dr. Candace Fraser. She's an OBGYN in Harlem, New York. And one of the folks that she went to med school with was someone who had given me advice on how to start the company. And then I talked to her and I was like, hey, I'm building this thing. I need someone on my clinical team to kind of help us understand, how to provide care for young people. And she got super excited. We ended up doing a pilot together. And then post the pilot, it was a 2,000 patient pilot we did with her in her hospital. She was just like, you know what? I want to help you. Let's do this thing together. I feel like you're going places. So
you mentioned that you have piloted your product with 2,000 patients, but since then, how many more patients have you had in your platform now?
Oh, wow. So our initial platform had a different name. It was called Good Health. We rebranded. Initially, what it was doing was we were using that as like a chat-based platform where you could type in a question you had. So kind of the same way you can go on Google and type in a question and get a list of different websites and blog posts and things like that. Instead, you would get a list of different clinicians who you can connect with. So that's the first platform that we built. And then at that point, we got about 3,000 downloads. We felt like we were doing a lot of things. We had a ton of people, including, so I would say a total of like 5,000 people that were using the platform at the time. And then now, as we have, I would say, rebranded and transitioned over to Kiira, we're planning on launching at 4 universities this fall with approximately about 36,000 students.
That's great. And so how, like you mentioned earlier, like figuring out whether people's going to pay for it, who's going to pay for it in your business model right now?
So our business model is like a B2B2C model where the customer is like the student health insurance plans who cover the students' benefits on campus. And then the way we're getting to be able to reach our users is through the college university health center, women's resource centers, and things like that to be able to use to provide our service. So we're working in tandem with the health center to distribute our product to their students. Yeah.
So the insurance company pay for it, but you collaborate with the university to deploy it.
Yes.
And so the university students benefit from it.
Yes.
And then the university get the brownie points.
Pretty much. That's what we're hoping to achieve. That way they like us much better.
Yeah. No, that's great. And so, I mean, you're entrepreneurial. Like, what did you bring from your experience, when you're selling menswear e-commerce with African fabric and translate that to the work that you're doing? What are the things that you see commonality?
E-commerce is very tough. Manufacturing is hard. So I feel like anyone that can do that with the grits that it takes, a lot of it involves sales. So I was selling. So I feel like in, being an entrepreneur in like a startup, what you do is every single day you're selling something. You're selling yourself, you're selling the product, you're talking to a lot of people about, what you're doing for them to be able to buy in. So I feel like, that experience of, learning to do sales, learning to do marketing, learning to craft your messaging in a way that's tailored to whoever your customer is something that I really was able to bring into this new realm, in digital healthcare that I'm in now.
And so now that you've done a lot of selling, what are the 3 top advice that you can give somebody?
Top advice. I would say the first one is do your homework very well. Always be prepared. Always be prepared. And with homework is like research, just research the market. I have a ton of books that I read. I have a ton of publications that I follow to learn everything that I need to know, even within healthcare that has nothing to do with women's health. Just brushing up on those things is really important. Another thing is just, I've been really conscious about my mental health. I think that's something that's very important in terms of running a company or being an entrepreneur. Don't take your mental health for granted. That's my advice. You can do a lot of things, but you can't do everything. But always remembering what I've done recently is set out a time on my calendar where no one can schedule a meeting with me, and that's like crystal time. So I think crystal time is very important. And I also, the last thing is just, being able to be teachable and learning. Because you can get like mentors and people talking to you, but you're just going with your own way because you feel like you know it. I could have come in saying, well, I've sold stuff. I've run a company before. No one can tell me what to do. But then I came into healthcare and I was just like, you have never really run anything. It was just a brand new world that I was just like, okay, I'm going to unlearn everything that I thought that I knew. And I'm going to learn everything else now. And it's still a process, but, just being teachable in that way is important.
Yeah, it's I guess humility goes a long way.
Absolutely.
So, I mean, you mentioned that you always like to do something entrepreneurial. Where did that come from? I mean, what inspired you?
First things first, I would say my parents. My dad was a huge entrepreneur back home in Nigeria. He used to run several companies. I think he worked at some point. He owned a security business. When I say security, I mean like I'm trying to use the words that are best for security in terms of safety. That's what I mean, not cash. So security business for safety. He ran a company like that. And then he was in real estate. So he owned an estate in Nigeria. He was a landlord. He did a bunch of things. So just seeing him and seeing the kind of lifestyle that he lived, it just gave him the liberty to travel. It gave him the liberty to be in different places. I saw him just being a leader and people, depending on him for certain things and making decisions. And I just wanted that to be me because I was always running around the place. Oh, my daddy owns this office, But a part of me just knew that I didn't want to follow his path in the exact, type of industry he was in. But I absolutely knew that I wanted to be my dad as a woman, basically, in a lot of ways. So that's exactly where it came from.
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
So where do you see Kiira in the next 3 years? Like what your envision of Kiira? Is it going to focus more on women's health in the young women, or do you foresee that opportunity to be beyond that?
Yes, I think there's a large opportunity for us. One thing that's really important, and I feel like that's what makes us unique and different from every other company in the women's health space, is we are doing something that a lot of companies already know, which is to tap into a market from the youngest age possible, right? When you think about I remember when I went to college, like I said, being an international student, the first thing I opened was a bank account, right? And I've used that bank account till now. That's still my bank. And this has been years ago since I started that. And I feel like for us we're starting there, we're tapping into their market. We're making sure, young women are equipped to where when, for whichever reason, later down in life, they want to have babies, they make any of the choices that they want to make in their life, whether or not it is to have a child, they're more prepared. They have lower risk of, maternal mortality, for example, or even other adverse health issues. And then through their lifetime, they're able to continue to, put their health first. I think that's really important because, a lot of times you see people going, they're about to get pregnant and that's the first time they ever see a gynecologist or any doctor whatsoever. So for us, I feel like there is still like a really big market to be grabbed from the young women's space. And we plan to be there. However, I think in the next 3 years, my top priority would be to be on every college campus in the US. Like that is the priority. If we win there, then we can do anything else we want to do. So
yeah, that would be great. And I, just want to ask you this question. I'm sure there's a lot of other people who has thought about similar ideas with you in terms of like tapping into the young women in colleges. But what makes your product sticky and what make your product works that people wants to be part of it, Kiira? What's your psychology to get everybody you provide that value?
Yeah, for sure. There's a couple of things. One thing, like I said before, is the colleges are benefiting from bringing this product on campus, right? And their students are benefiting as well. So it's like a win-win for everybody. I think having those two platforms that way interconnected and working like that is huge for us because competitors people have seen they would have like an app that does virtual care with telemedicine being more popular, but the key thing here is that seamless interaction between the university themselves or whoever the administrators are and understanding how their student population is doing, increasing retention rates, increasing their health outcomes and things like that, but also from the student side benefiting from Kiira. And I feel like one major thing for me, I feel like my experience also contributes to what makes us different. Being, like I said, an international student, being a Black woman, being someone who's an immigrant, a lot of what I saw when I moved here was there was a lot of students from really diverse backgrounds on these campuses. And what's really missed sometimes is not having clinicians who are representative of all these students. And what we've been very, very mindful of is we have a multicultural clinician base who can serve different students from different cultural backgrounds. I feel like cultural competency has been really important in this process because at the end of the day, a lot of the students who may be seeing a doctor for the first time, maybe from a different country and all these things might not feel comfortable to talk about what's going on because they don't see someone who looks and feels like them who can understand their needs. So I think that's where we come in and we're just making a difference in that respect. From making sure, they have people that look like them on the platform who can actually deliver the care they need.
And the care providers, they come from more the locally, or is it something that you recruit nationwide?
So we're able to recruit nationwide. Like I said, that is our plan to be in all 50 states and all campuses. The good thing about how our product is right now is when we started, like I said, we're delivering chat-based consults, right? Just text messaging for health educational information. And based on that, we were able to recruit a number of clinicians from all over, right? So what we're doing now is kind of going state by state. So we're starting first in New York. We've hired a ton of clinicians in the New York area to serve the students in that area. And we're expanding in California next. And we just kind of make progress from there. So, yeah.
That's great. And you obviously start this company like only a year ago, but the progress that you make is just immense and amazing. I almost think that you do a lot of the work, but you have the execution skill that allow you to make this many progress. Can you tell us more about what's your tips, like what's your secret in getting your execution done in such an efficient way and effectively?
That's a good one. So it's a couple of things. One thing is I have a fantastic team. I think developing like that human capital is very important, and having folks who truly buy in and believe in what you're doing and are on this journey with you is very, very key in this. I think what has made me accelerate my personal growth and the growth of the company has been watching people like me go through this process already. So I have a very nice, tight network of entrepreneurs who've been there, done that, failed, made progress. And I look to them all the time before I make a lot of decisions. So it's like, I'm never, seeing it as, oh, you failed at this. I'm going to ask you, why did you fail? So I don't do it, and you tend to see a lot of people are very open to that, conversation, because they're like, okay, I'll do whatever to make sure you don't do what I did, or you don't spend 2 years doing this when you could do it in a month, So that has been really helpful, just leaning on those entrepreneurs who have, made some level of success, who have failed at things, who have won at things, and just learning from them. So mentorship from entrepreneurs like me has been great. Another thing is just emotional support is very important in this process, because I feel like, it is very challenging. It is difficult. It's not as glamorous as, people paint it to be, just being an entrepreneur, starting a company, because a lot of times, people see all the highlights and all the, news articles and all these things, but they don't really see what went behind building it. So it takes a lot of emotional support from friends, from family, from people around to just keep a person sane and keep you in this lane to really accelerate your growth. I also happen to be an overachiever. It's kind of like in my DNA to do a lot of high demanding things, and being able, I remember so I live in LA now, but I used to live in Texas. And before I moved here, I got a job in LA, and I didn't quite have any plan per se. All I knew was I was going to get this highly paying job that I was not going to get back home in Houston. And I got into my car and I drove 20 something hours to LA. So my brain just works that way, when it's like, if I want to get something done, I'm not going to back down. So it's that grit and that, being able to fail, get back up, but get whatever you want to do done. And that's just me. I'm like, I'm not failing. I'm here. I'm going to get it done. I will learn everything and just keep moving forward.
One step at a time, or 2 steps at a time.
Yeah, one step at a time. Absolutely.
Well, this is great. And I'm just amazed how much progress that you make within such a short period of time. And I think you're doing a lot of great work, and the passion that you have in trying to serve more young women in this space, I think that is really awesome. Well, thank you for sharing with me.
Thank you.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, our content writer, Casper Mossman, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.